Good afternoon and welcome to this public hearing of Columbus City Council's Health and Human Services Committee. I am Council President Pro Tem Priscilla Tyson, Chair of the Health and Human Services Committee. Before getting started, I want to make everyone aware that this hearing is being recorded for rebroadcast on CTV, Columbus Government Channel 3, and the rebroadcast schedule is available at www.columbus.gov. The topic of this afternoon's hearing is Minority Health Month, which occurs in April. This month allows us to highlight and discuss the health disparities among particular groups of residents in our community, the services available to these groups, and the city's ongoing efforts to address these disparities to enhance overall health equity in the city of Columbus. Before we begin, I would like to explain to our viewing audience the origins of Minority Health Month and why it has become such a critical time for our community. It was created in 1989. Minority Health Month is an annual campaign which focuses on health awareness and disease prevention in minority communities. In short, the 5 goals of Minority Health Month are: 1, to provide critical information for individuals to practice prevention; 2, to promote healthy and active lifestyles; 3, to showcase the resources for and providers of grassroots health care and information; 4, to bring attention to the desperate health conditions between Ohio's minority and non-minority populations; and lastly, to gain support for ongoing efforts to improve minority health year-round. Central to the mission and the message of Minority Health Month is the fact that certain groups carry a disproportionate burden with regard to incidence, prevalence, and mortality of certain diseases and health conditions. These are commonly referred to as health disparities. Health disparities are not limited to any single disease or health condition and are both measured and monitored through the use of public health data. Most health disparities affect groups who are marginalized due to their socioeconomic status, race, ethnicity, sexual orientation, gender, disability status, geographic location, or some combination of all of these factors. Individuals in minority populations tend to have limited access to resources that many of us take for granted, such as healthy foods, reliable and secure housing, a quality education, safe neighborhoods, and freedom from racism and other forms of discrimination. The purpose of this afternoon's hearing is to learn more about the illnesses and social determinants that disproportionately impact minority communities, as well as review some of the programs and services that Columbus Public Health is pursuing to fulfill its mission to address health disparities that exist in our community. Presenters today include Ryan Johnson, who is Director of Columbus Public Health's Office of Minority Health; Shannon Young, who is the Division Director and Family Health Division; Autumn Trombetta, who is the Section Chief and Chronic Disease Prevention Neighborhood Health Division; and Liquori Meadows, PhD, County Extension Director for The Ohio State University. And with that, I'm so happy you all are here. I'm excited about this hearing. And Mr. Ryan Johnson, the floor is yours.
All righty. Well, first of all, thank you, President Pro Tem Tyson. On behalf of my colleagues that are here this afternoon, I would like to say good afternoon. Thank you for the opportunity to have a conversation focused on minority health. Columbus Public Health is charged with assuring conditions in which people definitely can and will be healthy. This afternoon's agenda will center around 6 different things. So I'll provide an overview including the department mission and goals. I would discuss the structure and work of the Office of Minority Health here at Columbus Public Health. We will review 2 of the department's strategic priorities, which are infant mortality and overweight obesity. The other priorities will be covered as we sit here again on April the 19th at 3:30. Continuing through the agenda, we will also review data, and that data as it relates to our 2 priorities, what work we are currently doing to address these disparities. Our team will provide stories from the field that are specific to the wonderful work that we do. And then last but certainly not least, we'll highlight Minority Health Month, which is April. So the mission of Columbus Public Health is to protect health and improve lives within our community. CPH is focused on factors and conditions known to impact health and diseases. The environment in which you live, work, learn, and play impacts your health. Through customer focus, accountability, research, and equity, Columbus Public Health has a rich history of helping people live healthier and safer lives, promoting social justice, and serving the underserved, so we definitely care. The goals of Columbus Public Health are to identify and respond to public health threats, collaborate to address gaps in public health, empower people and neighborhoods, and establish and maintain capacity and resources to ensure continuous quality improvement. The Office of Minority Health. We have an important responsibility in leading efforts to educate citizens and professionals on imperative healthcare issues. And so this is achieved through our 4 core competencies on the slide. Funding is through the City of Columbus and a small grant from the Ohio Commission on Minority Health. The Minority Health Advisory Committee meets on a regular basis, which guides our work every day. Listed here are some of the local stakeholders who participate on the Office of Minority Health at Columbus Public Health Advisory Committee. And I certainly don't have time to read all of that, but trust me, they are there. Any interested organization or individual that lives, works, worships in Columbus or Franklin County can be part of our Minority Health Advisory Committee. And if you're interested, please call me. My number is 645-7335, or you can email me at rejohnson@columbus.gov. Now, this is our overall organizational structure with the Office of Minority Health here at Columbus Public Health. Our